You are listening to 40 Weeks with Vanessa Merton, host of the Pregnancy Podcast. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 7. By the end of this week, the embryo will more than double its length to 1/2 inch or 1.3 centimeters. So your little sweet pea is now the size of a small blueberry. While that still seems pretty small, keep in mind that that is 10,000 times bigger than it was at conception a month ago. Crazy, isn't it? At 7 weeks, most of the growing your little one is doing is concentrated in the head as their new brain cells are being generated at the rate of 100 per minute. Your little Einstein is going to be so smart. Your baby's arms and legs start developing more this week, and their arms and leg buds begin to sprout and grow longer and stronger. The arm buds are also dividing into hand, arm, and shoulder segments, and the leg buds are dividing into leg, knee, and foot segments. Would you believe that your little blueberry has already gone through 3 sets of kidneys? The ones that are in place now are permanent and are ready to begin their important work of waste management. You are probably gearing up for an appointment with a doctor or midwife soon. The number one tip: ask questions. Ask all of the questions. Start making a list now as you think about things. That's what doctors or midwives are there for. So do not be intimidated. Remember, there is no such thing as a stupid question. Please be sure to take your partner with you so that they get involved and have an opportunity to ask questions too. You might be getting a bit of a boob job as your chest is growing. The bad news is that you might have a tougher time fitting into your normal tops. By week 7, many women have grown a full cup size. Unfortunately, those pesky hormones that are making your boobs huge are also making them really sore, so don't feel bad if you have a hands-off policy. Your areola may already have gotten a little bit darker in color, and it will continue to do so. The color contrast between your areola and your skin serves as a target to help your little one find the milk once they are born. Your uterus is also growing and has doubled in size over the last 5 weeks. Although you may feel like running to your OB or midwife, they usually make you wait until week 8 to come in for a visit. Now would be a great time to start looking into what type of professional you would like to work with. There are a lot of options beyond an OBGYN and having a baby in a hospital. To learn about what some of your options are, and especially what your role is in your prenatal care, check out episode 2 of the Pregnancy Podcast at pregnancypodcast.com/episode 2. Tip for dad: you will probably notice that your significant other looks like they got a boob job, and they did. But the downside is that their chest is probably going to be really sensitive and tender, so you definitely want to ask before you touch. Thank you so much for tuning in. Show notes for this episode can be found at pregnancypodcast.com/week 7. Next week, your little one starts making spontaneous movements, and until then, I wish you the very best on your pregnancy journey. There are so many awesome resources available to you at pregnancypodcast.com, and you can sign up with your email address and your due date to get a weekly email with a link to the episode for your specific week every week in your inbox. I look forward to seeing you in the Pregnancy Podcast Facebook group, which is a great place not only to connect with some other parents-to-be, but also to be able to ask questions and get answers specific to things that you are dealing with and planning for your pregnancy and birth.